Okay, Tarik, we're live. How are you?
I'm great, Jake. How are you?
Yeah, really good, and so pleased to get to do a podcast episode with you again.
It
So
must have
I'm
been, what,
gonna,
a couple of years now, is it? Something like that,
yes, at
probably.
least I finished. I stopped recording episodes for Bitcoin with Jake in April of 2023. So at least 2 years has gone by,
Wow.
um, and I'm very excited because everyone's progress that I had on that podcast is just it's ramped up, and a lot of that's
Yeah.
to do with Bitcoin, and we'll talk about this today, but. Where I want to start is very broad, but as someone working in the healthcare industry, please outline, your day-to-day role, doing what you are an absolute expert in. And what I'd love to understand is how does the impact of sound money affect healthcare?
Okay. Well, a bit about my background. I mean, we probably went through this last time, but just for the benefit of any new
Yeah.
listeners. So I'm what's called a colorectal surgeon, but I mainly specialize in bowel cancer surgery and bowel cancer oncology. So I'm kind of one of those, big city hospital surgeons that's very specialized in a small area. Pretty much all I do pretty much is treat bowel cancer patients all day, every day, almost. And particularly when it comes to more advanced cancers that, require bigger operations and more advanced sort of chemotherapy and that sort of thing. So that's my area of interest and expertise. That's about, most of my week, but a part of my week is also doing research around cancer treatment and outcomes in cancer patients. So I'm a associate professor at the University of Adelaide and a surgeon at the Royal Adelaide. So I've got those two hats on. And then, Bitcoin enthusiast on the side. And I would consider myself a Bitcoin maximalist in the traditional sense of the word. I know we don't you don't hear that word banded around as much because almost everyone now is a Bitcoin maximalist. A lot of the other stuff has kind of
Yeah.
fallen away. So, but yeah, so I believe in sound money. I'm a big fan of Bitcoin and what it stands for. And I've, since we last spoke, I've learned more and more about it, I think, and it's sort of a never ending journey. With regards to what does the impact of sound money have on my work professional life, um, it's pretty clear. I think if you ask any doctor or any observer that there is a problem with healthcare funding that seems to be systemic and seems to be getting worse all the time in places that we live in and we work in. And I think the underlying reason for that is an issue with how the money system works and how it's distributed. In particular, with regards to how inflation in the price of healthcare seems to be outpacing the increases in funding that are delivered to healthcare by most governments, particularly in the Western world. And since we last spoke, I've developed some of those ideas a lot further. I remember in the last podcast we did, you sort of asked me, how is Bitcoin supposed to fix healthcare? I really didn't have an answer for that, and I hadn't sort of thought that through very well. But as we've began to understand Bitcoin more and the issues affecting the healthcare system more, it becomes clearer that the two are related in more ways than one.
The cost of supplying health services is going up faster than the funding that's arriving. How does that actually play out in reality?
Bed pressures mainly, which mean that we don't have enough beds to treat the patients that we need to treat. And that's sort of the most important element. And that factors into every other aspect. So, for example, you might hear about ambulance ramping, where ambulances are parked outside the hospital. The reason for that is not that there's not enough ambulances. The reason is there's not enough beds in the hospital to put patients in. And so because the hospital's full and the emergency departments are full because the patients being seen in the emergency departments can't be transferred to beds on the ward, the ambulance has nowhere to put the patients that are arriving, the new patients. And so they have to wait outside because the safest place for a sick patient, if you don't have a bed in the hospital, is physically in the ambulance waiting to get in. So the ambulances just ramp up outside. So that's one example. The other example is, surgical waiting lists blow out. Again, similar reasons. So where I work, we have a big problem where we have enough surgeons, we have enough physical theaters to do the operations in. We just don't have the resourcing in terms of other staff and in terms of beds to put the patients in when we're done with the surgery. So operations get canceled on a regular basis because there are no beds to put the patients in after the surgery. And so the analogy I sometimes give people is everyone's quite familiar with the housing crisis where, is the connection okay on your end?
I can hear you, so it's okay. We'll be able to patch it together. Don't worry.
Okay. So one analogy I give is with the housing crisis, which everyone seems to understand pretty well. It's a similar issue, except healthcare prices go up even faster than housing prices because it's a harder asset, it's a scarcer asset. It's more difficult to make a hospital bed than it is to make a motel bed or a apartment bed. And so it stands to reason that whatever problems you get in the housing market, you get a magnified problem in the healthcare market by the same rationale.
Wow. Interesting. Okay, and so where I would like to go first, I think, with this is, and I'm sure you've found this yourself, as I've asked the question, what is money? As I've studied Bitcoin, I have come across the field of Austrian economics and the idea of human action and free markets, and where possible, enabling free markets to exist. An area like what you're describing here is full of interventions, whether that be the medical system itself or government trying to fund it. And when you see a lack of beds or whatever the bottleneck might be, why can't the free market just solve that problem? What are the hurdles in the way for that to actually happen?
Yeah, I mean, that's a very good question. I am also a believer in free markets, but free markets don't necessarily work very well in providing essential services. And one of the issues we have in the Bitcoin community is that most of us are sort of libertarian, ultra capitalist leaning. And that's okay. But you mean the health system in the US is a lot more free market than it is here, but their outcomes are significantly worse than what we have here at a population level. And that's because when you're trying to provide an essential service, such as healthcare, and you leave it up to the free market, that leaves it open to abuse because the free market dynamics that determine pricing are easily abused when the service that you're providing is literally life-saving. And so that means that you can charge an extortionate amount, or you can manipulate the free market system to charge an extortionate amount, or restrict access to only those that have that money to pay you. And so somewhere like the US, where it is a lot more capitalist in the way the health system is designed, they end up having higher prices for things than you would otherwise expect. And the access ends up being even more limited than you would otherwise expect. And so that's one issue. In a market like ours in Australia, where it's about 50-50, which is pretty optimal, you sort of want the public sector and the private sector to be duking it out and both competing and complementary in the delivery of service. The way that works is that both sectors, the public and the private sector, allow for venting from one system to the other as required. So they actually compete against each other, which is also a free market dynamic. It's just it happens to be between the taxpayer and the insurer sort of thing, or between the public sector and the private sector. So as an example, if the private sector were to begin extortionately charging high prices like they do in America, a percentage of the public will just default to the public sector where they can get free healthcare, albeit perhaps at a lower quality. Alternatively, if the public sector slows down a lot like it is now, then the public has the option to pay more and go to the private sector. So it has this function of balancing things out where the consumer actually has a choice between a private market and a public market. As opposed to in some places like the NHS, which is almost all public, and the US system, which is almost all private, and when you have that setup, it doesn't function as well because you don't have as equal a choice as a consumer to move between the sectors. Now, one of the issues we have in Australia at the moment, which is a fairly recent problem, is that a lot of the private healthcare providers are beginning to struggle financially. So I think you're in Melbourne, aren't you, Jake? Is that right? So
I'm actually in Byron Bay now, but
Byron Bay,
yes,
okay.
I was in Melbourne
when you were
for a
in
long
Melbourne,
time.
yeah. So HealthScope is a big private healthcare provider that runs a whole bunch of private hospitals around the country, a few in Melbourne, in Adelaide, and other places. And they're, at the point where they're fiscally doesn't really make sense to continue their enterprise. So they're losing more money than they're making. And the reason that's happening, I believe, is because only one party, when you compare the public and the private sectors, only one party has a money printer, the other one doesn't. And so when the public sector becomes relatively dominant and relatively fiscally irresponsible and prints a whole bunch of money and increases the prices of delivering healthcare beyond a sustainable limit, the private sector struggles to make a profit.
To those listening out there, we had some connectivity issues. So what we'll try and do is pick up the conversation roughly where we were. We were talking about a number of different realities when it comes to how to provide healthcare and the nuance between a public funded organization and a private funded organization, and the reality that you see in the United States, where actually, because of something genuinely being life-saving, the provider of that service, and it's an acute demand, an acute problem, could charge an extortionate amount of money. And therefore, like, how do you draw the line? What becomes abuse or what doesn't? So a fascinating ethical conversation. But it's intriguing as well to then overlay that with the different bottlenecks that you've already described about how, like, there might not be enough beds, or there's not enough ambulances, or whatever the nuance might be. So is there a solution to this, Tarik?
Yeah, well, I mean, it might seem like an impossible task, but in reality, even within our own countries, it wasn't always like this. So if you go back to the 40s, 50s, 60s, we seem to be able to deliver the healthcare and pay for it with our own resources. A lot of the aspects of healthcare, like a lot of technology, should be deflationary. So things should be getting cheaper. Certain aspects of healthcare technology should be getting cheaper. We should be becoming more efficient at delivering healthcare using these technologies. So, yeah, is there a solution to this problem? I think there is. I think it would involve, sound fiscal policy, sound monetary policy, which would have a few effects. The first would be that the rate of inflation of healthcare pricing would be tempered and would be reduced. But secondly, allocation of funding. So at the moment, the way the monetary system works is a whole bunch of money that the government has, either printed or through revenue, that they distribute. And the distribution mechanism is top down through reserve banks, followed by retail banks, followed by everything else. And so a lot of the monetary energy is being dispersed in ways where we as citizens may not be happy with. That includes funding things we don't want them to fund, but it also includes the sort of Cantillon leak that happens. So, where banks seem to be making billions of dollars of profit every year, real estate agents seem to be making millions of dollars of profit each every year. All of this financial energy could be reallocated in a way where we pay for things that we want rather than in relation to proximity to the original money printer in terms of how the money is distributed. And so I do think there's enough money to pay for healthcare. I just think that inflating the price of healthcare astronomically and then allocating an extra 3% a year in the budget is not the way to do it.
Okay. And so, following this on a little further, one thing I always like to try and understand is, it's basically this idea that building on fiat currency is very, very hard, whereas building on a sound money, in theory, is a lot easier. So, I mean, is Bitcoin even spoken about in the professional circles that you spend time? Are people interested in adopting a different form of money to potentially solve some of these issues?
I don't think we're at that point yet. I think we're at the point now where healthcare professionals are sort of starting to wake up to what's going on, just beginning to. And I think COVID had a lot to do with that. And I think the ethical implications of putting all your excess wealth in housing is becoming somewhat unacceptable in my sort of professional community, because we can see that the system is breaking down and that our kids and our grandkids aren't ever going to be able to buy a house. And because medical people tend to be, at least have a basic level of altruism towards society, that's why we go into this. It kind of makes it hard for, say, surgeons to just buy 6 or 7 houses, which was traditionally what happened. It's dawning upon us that there is something fundamentally wrong with the way the system is set up, but I'm not sure that people have connected the dots between the broken money system and the failing healthcare outcomes. I think it's starting to dawn upon people that there's a connection between the broken money system and failing sort of financial investing type outcomes to do with property and stock market and money printing and all this sort of stuff. But I don't think they've quite made the connection to what we're seeing in the healthcare setting. I think the average doctor still thinks, for example, that the reason healthcare is suffering is because of, uncontrolled immigration and an aging population. So they still think of it as a
Mm,
supply and demand mismatch, um,
mm,
just like a lot of people think housing is. But in fact, we know that there's another force at play. It's not just supply and demand. And the reason we know that is because independent of demand, healthcare outcomes or the ability to pay for healthcare per person is reducing regardless of demand. So even if the population was constant and the population wasn't aging, we would still have fewer beds than we used to have in the 60s because we can't pay for the beds with the money that we've got. So it's not a simple supply demand equation. It's more that the because the financial system is unraveling, expensive things like hospital beds and operations become harder to pay for. And that's a completely separate issue to the increasing demand due to the aging population, which is a factor, but it's just not the main factor. It's just one of several factors.
It strikes me actually that a hospital bed is in some ways a reflection of scarcity as a driver of value. So
Absolutely.
they're just not very easy to create, and therefore they're
Yeah, it's
very
hard money.
valuable. Yes, in
Yeah, I
some
mean,
ways, yeah.
I did the podcast with Peter McCormick last year, sometime around the Bitcoin
Mm,
conference that he had, and they have this. I tried to ask them to show this chart of like inflation in different sectors that are measured in America with time, and hospital services are by far like the top of the list. So it sort of
wow.
goes like technology becomes cheaper, so televisions and computers become cheaper. Then you've got things like food and the usual things we think of with CPI. And then you've got housing, which is inflates at a faster rate. And then right up the top of the list is hospital services. So the estimate in the US is that inflation in hospital services is somewhere between 10 and 20% a year in terms of the price of paying for stuff. And that's been
Hmm.
going up for decades now. And
Wow.
so you can see that if your government is spending 3% more on healthcare, which sounds good in theory, the governments every year with every election they go, we're going to spend this many more $1 billion, and it usually works out to about 3%, 2 to 3% more. But if the price of a hospital bed is now 10 to 20% more, then you're going to get fewer beds for the money that you've spent. It's just that simple. And as a result of that, we continue to fall behind every year because of just chronic underfunding.
Wow. And so, Tarik, I really love learning about people's decision making and, the ups and the downs. You touched on a moment ago the idea of altruism as a driver for becoming a surgeon in the first instance. What does that mean to you? And can you teach us about like why you actually decided to go into this profession?
Yeah, well, it's a combination of things. I mean, um, medicine in general as a profession has a few really good things about it. It's very generally well respected, although things like COVID, sometimes the medical profession takes a hit after something like that in terms of the general public's trust and respect. Um, but generally respected, generally well paid, very stable job, very interesting. So, you're dealing with real people all day, every day, and most of the time you're helping them and they're getting better and they're very grateful. So it's very rewarding from that point of view. It's very interesting from a biological standpoint, understanding whatever part of the human body you're an expert in and trying to get good at fixing that part when it goes wrong. Um, it's a 3D biological living thing that you're trying to work with, which is really exciting and very interesting. But then there's this element of like, serving society, serving the population. And most doctors, at least when they start out, do it in part because they see it as a noble thing to do, helping people. Now, as medical training happens and you do the long hours and you don't sleep and you get yelled at a few times and, bad stuff happens, people tend to get jaded and they forget, 10 years into it, they may forget why they did medicine to begin with. You know what I mean?
Mm,
So there is a bit of, there is a bit of waning of that with time if you're not careful because you tend to focus on other things that occupy your attention, and you stop thinking about why you actually did medicine to begin with. But in general, it is a very noble profession. It's very exciting and interesting in different ways. There's a very broad spectrum where you could go for the, super junky adrenaline trauma surgery kind of, brain surgery kind of stuff. On the other side, you've got things like dermatology, which are very easygoing and relaxed, but still interesting. So, and you can have as much or as little adrenaline hit as you would like. So it's quite a broad range of different medical specialties with different traits. So, and that most people tend to settle on some form of combination of interest in the disease process or in the organ, and some sort of level that suits them in terms of how much adrenaline and risk do you want to take on a day-to-day basis? How busy do you want to be? How stressed do you want to be? Someone like myself, I like a certain amount of stress. I enjoy it. I work optimally under a certain amount of stress. I like managing sick patients that come in very sick, and I can do something to help them, and something immediate to help them, like an operation. Whereas other personalities prefer a quieter life where you're still treating illness, but the patients perhaps are not as immediately under immediate life threat as they would be, say, in some of the things that I do with cancer and with emergencies. So, in general, you'll find different personalities in different professions, different medical professions. There's a surgical archetype, and there's an anesthetic archetype, and there's a GP archetype, and it's usually some combination of what are you interested in professionally and how much adrenaline do you want on a hour to hour, day to day basis. And then an underlying current of I just want to help people. And this is a good way I know how to help people and have a decently paying, good quality job.
Awesome. It's very clear to me. I can feel the energy behind like why you do this. The next part of what I'm intrigued in is how. So can you give me a case study, shall we say, of like the state a person was in when they arrived and how you then helped them?
Okay, well, I'll give you a sort of, I mean, yes, I can give you lots of those, but I think people sometimes
Every day.
forget. Yeah, well, I think I get this from patients as well. Patients sometimes forget like what the volume of patients that we actually deal with. So like a typical week for me is say 1 or 2 days of just operating on patients. And sometimes that's one operation for the entire day. And sometimes it's, 6 operations in one day. So that's sort of 1 or 2 days a week. And then 1 or 2 days a week, I do colonoscopy. So I'm trying to find bowel cancers and prevent bowel cancers. And then 1 day a week is half of it is sort of outpatient clinics where I see new patients and see patients I've operated on. And then there's emergency on call, which I do a 1 in 6 or 1 in 5 on call, which means I'm on for 1 week for any emergency bowel problem that comes up at the Royal Adelaide, which is about an 800-bed hospital in the city. And that week I might do 4 or 5 very high intensity, very emergent, life-threatening operations, trying to fix people that have bowel perforations or bowel obstructions and things like that. Sometimes extremely sick, as in, might die within an hour if they don't get surgery type sick.
Wow.
And then increasingly we see patients where, because we've got quite an elderly population, particularly in Adelaide. So we'll see patients who are, at the latter stages of their life, like they might have severe dementia, they're dependent for most of their cares, and the final event is something wrong with their bowel, like the bit of the bowel dies off or blocks off. And then you have to make a decision, like, should you put this patient through an operation, and to what end? Do they want an operation? Do they have capacity to make that decision? Or should you be speaking to somebody who has power of attorney to decide that? So that's a sort of a common scenario. My day today, so I had, just before I came online with you, I had an outpatient clinic. I saw 15 patients, most of whom were new patients. And most of them had either bowel cancer or some sort of bowel problem. Some of them were very young with very advanced cancers. And at that point, it's a bit unclear if you can fix them or not. But there's very comprehensive strategies as to how you manage that in terms of different treatment options, and then ultimately, potentially quite a big operation. And not everybody's up for that, either physically or psychologically. Some patients, particularly post-COVID, are really distrusting of the medical profession. So if someone like me is trying to say to them, look, we're going to have to take your bowel out, your bladder out, your prostate out, and you're going to have 2 bags at the end of it. But if we do that, you're cured. Some patients are understandably very skeptical of that. You know, people are skeptical of a vaccine shot, let alone a 9-hour operation.
Mm.
So that's how patient by patient, scenario by scenario, different personalities, different physical fitness with every patient, and then different risk benefit for the treatment that you can offer. So sometimes the operation is 90% successful with a 1% chance of dying. Sometimes the operation is 10% successful with a 90% chance of dying from the surgery. And so you have to convey that information. And as the surgeon, as the patient, you have to come to an understanding and an agreement as to what is the best way forward. And ultimately, the patient gets the say. But that's kind of day to day.
Wow. And just so many directions I'd like to go in, but I have to pick up on a word that you mentioned, which was prevent. So, in many ways, if your services weren't needed, that would be the optimal scenario for everyone.
Correct.
Um,
Yes.
in your niche and in your experience thus far, like what are the best forms of prevention that you've helped patients, or maybe they get to you too late already? What does prevention really mean?
I often will say this. Sometimes as surgeons, we forget that we're the ambulance at the bottom of the cliff. Like by the time you're
Mm,
getting an operation for your bowel cancer, that's pretty much often the last step or second to last step, right? And because we get so focused on the surgery and how to do the surgery, we kind of forget that part. So particularly in cancer, because I'm becoming known around Adelaide and Australia for a particular line that pisses some surgeons off and challenges other surgeons, and some surgeons really like, which is that cancer is a software problem, not a hardware problem, and surgery is a hardware solution. So
wow.
because cancer is a genetic problem, and those genes become faulty and turn into a cancer because of a combination of genetic problems, natural aging, which results in mechanisms that result in your genes malfunctioning, but also lifestyle factors such as smoking and
Yes.
obesity and alcoholism and things like that. All of those conspire to create a genetic problem that manifests as a cancer. And what we do is we take out that part of your body, which is very glorious when looked at from a traditional sense, traditional barbershop sense. You save someone with your hands. But when looked at from an intellectual sense, is actually fairly barbaric and fairly blunt. There should
Mm,
be a better way to either prevent or treat these code malfunctions other than just chucking out the hard drive and putting a new one in, or even worse, chucking out the hard drive and asking you to live without it most of the time. So, so how do you prevent bowel cancer? The step before surgery, only one step before surgery, is screening. So what we do is we send people a whole bunch of tests. And the idea behind the colonoscopy is you pick up a cancer when it's just a small polyp before it has a chance to mutate enough to become a cancer, and you remove it. And that's a fairly safe procedure. But again, it is a hardware solution to a software problem. One step before colonoscopy is lifestyle changes. And those are things like don't be fat, don't drink too much alcohol, don't smoke. Those are factors that contribute to all cancers, including colorectal cancer. Now, what's interesting about Bitcoin and the time preference situation is, I mean, you've gone to the Bitcoin conferences. How many grossly unhealthy people do you see at those conferences? Because I can tell you that at other conferences that I go to, like surgical conferences, the average person is much more unhealthy. And these are
wow.
surgical conferences. So,
Mm,
what is it about Bitcoiners and Bitcoin, other than the fact that it tends to be a relatively younger group? But there's something about it that promotes healthy living in general. And my view, and I guess a lot of us view, is that it is the time preference thing. When you have hope for the future, when you can plan for the future, when you can save for the future, you are incentivized to perhaps have a set of behaviors that are advantageous, you know? Whereas if your money is disappearing beneath you and there's no incentive to save, you're more likely to spend the money and perhaps live for the now, perhaps eat a little bit more fatty foods, perhaps drink a bit more, perhaps gamble a bit more. And all of those unhealthy consumerist type incentivized fiat behaviors contribute to why we've seen an explosion in obesity in the Western world, in since the 70s. Because prior to the 70s, we had alcohol and we had fatty foods and we had cigarettes, but people were generally healthier in the way that they lived. And so what changed in the 70s? And people like us think that what changed is the money became broken at one point,
Mm.
and that incentivized a whole bunch of bad behaviors that results in worse healthcare outcomes, including cancer.
Tarik, it's funny. You teed me up so well there, because that's exactly where I wanted to take the conversation. It's like, okay, so this connection between sound money and sound mind and sound body. And it's this kind of holy grail in some ways of like preventative healthcare. And people haven't yet drawn the dots that like the money you use directly correlates to your health. And that's quite understandable, because frankly, no one asks the question, what is money? And it's one of the reasons why I've found it one of the most intellectually stimulating things to get involved in, because it's like, hang on, money's everywhere. It touches every part of my life in every trade that I do. And to your point, when you physically go to some of these conferences, it's fairly obvious that people are operating on a different like paradigm entirely to what's happening outside the door of that conference. It's
That's
really quite
exactly right.
wild.
Yeah.
And not in the same way that like I might have gone to a music festival back in the day and you walk through the front door and everyone's like, hedonistic, high on drugs and loving it. And it's like a different world. It is, but with a cost, like a week of hungover afterwards or whatever. But
I mean, one thing I
is
haven't
that,
quite sorted out, Jake, sorry, but one thing I haven't
please.
sorted out is like with my sciencey hat on, is this
Mm,
just selection bias? Like, are those of us that are prone to certain behaviors just naturally because of personality? Are we also the same type of people that are prone towards, idolizing Bitcoin? Or is it
mm.
the Bitcoin sound money theory that is changing the way we think about our lives? Haven't quite sorted that out yet, but I can tell you that people do seem to
Great
change.
question.
Yeah. I mean, we've seen people, I'm sure you have, that change their lifestyle pre and post, the adoption of Bitcoin. But I'm still not sure if it's just attracting a certain kind of person. I'm not sure. I'm not sure
Well,
about that, to be honest.
maybe that's as a minute test. Like when I think about my life, the closer I've got to Bitcoin, the larger it's grown as a portfolio allocation, if you want to call it that, from an investment perspective. The more optimistic I am about the future, and the more careful I am with just general resource management. So,
Yes.
what are you eating? Why are you eating it? How do I spend my time? What are the relationships that I actually have in my life? What do I want to keep? What do I want to get rid of? And it's brought me time and space to work on myself, and that's brought all sorts of benefits into my life that I didn't even know could be looked into, even including getting further out on the spirituality curve and using things like
Yeah.
meditation, and really starting to think about like fundamental questions like, what is life?
Yeah.
And what do I want?
Yeah.
So
It's
in
fascinating you
my
say
very
that.
minute point of view, it's changed me, but Bitcoin itself doesn't change. I think that's the
No.
really key bit.
Well,
So
that's the
Tarik,
point,
how
isn't
about
it?
yourself? Like, if we reflected on the last 2 or so years since we recorded Bitcoin with Jake, have your day-to-day actions changed? Has your mindset changed?
Yeah, I think so. I think so. And I have noticed a change in myself as Bitcoin has become a bigger part of my life, that other parts of my life seem to be sorting themselves out a little bit better.
Mm,
Alternatively, when I look at some of my colleagues who are, buried in fiat debt because their accountant tells them to be, because it's financially advantageous, I can see like this really quite toxic situation where, say, you're a surgeon and you're 50 or 60 and you've borrowed all this money to buy all these houses because your accountant said that's the way you should do it. And then the interest rate goes up to 5%, and all of a sudden you're very stressed because you're in massive amounts of debt. And this is like examples all around me of this happening. And so you
wow.
can't focus on your job, which is to be a surgeon, not to be a property speculator. That's what you
Mm,
that's what you want to do. You can't focus on your family. Your family situation is strained because of the amount of debt that you've self-inflicted on yourself based on fiat advice. And you perhaps start drinking more and eating unhealthily. So it's kind of hard to get your life in order when society has forced you, despite having a fairly significant income as a surgeon, to become a slave to your debt, which is
Wow.
extremely common in my circles.
Interesting.
You will hear of certain, I mean, you as a patient, you wouldn't hear of it, but as a colleague, you would hear that, I'm making $800,000 a year, but I can't afford to go away this year because I'm in so much debt. You know,
Wow.
that's a common statement that you hear in surgical meetings and things.
And Tarik, this is why I love podcasting, because I like to ask people, what do you see in your life? And it's a form of primary research that you cannot say that I haven't gone and asked people these questions. It's like you literally live and breathe this field every day, and you're passing this information to me, and I find that fascinating. So what's really going on here? And if I may, so because of dropping, do you have another 15 minutes to go to record
Absolutely,
some
take your
more?
time. Yeah, I have all night.
Yeah,
Don't worry.
cool.
Yeah.
Um, what does it mean when you create, through your specialization of skills, outsized returns from a value perspective, to now have a place with which you can safely store that value that you've created? How does that feel? And like the description you just gave of the person who previously has been using a leveraged real estate approach is now a speculator in the real estate industry with a large debt burden. It's a completely different world that those two people would operate in.
Absolutely different. Yeah.
And it makes so much more sense to have a savings technology that it protects your purchasing power.
Definitely the case. I mean, I don't know if you realize this, but the average surgeon is a property speculator. That's the average thing. And it might be reflective of the average wealthy Australian. The average wealthy Australian has an extraordinary amount of their wealth stored in property, or in some cases in super, but more often than not property. Um,
Mm.
that has a few perverse impacts, one on the society itself, one on the person's sense of guilt. So it's gotten to the point now where a lot of doctors are guilty about owning houses because of they can understand that it's not a good thing overall, but they don't necessarily see the way out. And Bitcoin is seen as like a funny token thing that they just laugh at most of the time still. So what does it mean? It means that you can focus on your job. You can focus on your craft, your profession, the thing that you are inherently good at as a human being and that you've chosen to pursue as a career, you know, which ultimately is a more noble cause. I mean, I won't apologize when I say this, but like with all due respect to professional property speculators or real estate agents, if you are a surgeon, right, you should not have to or think that you should have to become a part-time property speculator because it's not as good as the service that you're providing to your patients. So I find that it's quite liberating that I can focus my energy on providing that service. I don't have to focus my energy on how do I buy the next house and negotiate a settlement, which is like a common problem that surgeons have, like I'm onto my fifth house and I almost got it and I had to go to the auction and it didn't work out, or I bought the house and now there's a problem with it and I'm not sure how I'm gonna fix it up. And that's like common conversation, which is totally unnecessary, you know. Like it's an unnecessarily waste of your brain power and your skill set to be spending so much energy on that stuff. It frees me up to do my job. I don't have to worry about making a boatload of money in the private sector, which is the other way it manifests. So one way it manifests is in distraction, but the other way it manifests is in your actual work. So you might feel a pressure to do more private practice, and in the worst case scenario, to actually do operations that you are not wanting to do because you're not good at them, you're not particularly qualified in them, or even worse, if you're trying to decide between surgery and no surgery and it's a 50-50, and one pays you $5,000 and one pays you nothing, and you're in extreme amount of debt, does that influence your decision?
Mm.
I can't help but think it would, you know? So it has a lot of negative consequences on your day-to-day life. And I'm not sure if people necessarily realize that when it's happening to them, because they just think that's normal life.
Thank you so much for your time. The insight that you've
Anytime.
delivered, even though we've got only 40 or so minutes of recording, I'll make a note to the audience that we had some problems with the Wi-Fi or whatever, and they won't mind. What I think is cool is, and that last phase we were just going through, this idea that Bitcoin actually incentivizes increased specialization. That is so cool because it's so true. It's like, get really, 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 really good at what you do. And
Yeah.
the benefits of that, you can then save.
Yeah. I mean, the mind share that fiat occupies with the average doctor is surprisingly high.
Yes, is
Like
it?
you might be
Okay.
seeing your doctor and they might be thinking about their property portfolio while they're talking to you, which is not a normal thing.
No, it's not normal at all.
Yeah.
Okay, we've ridden our luck with our connectivity tonight, so we're gonna close it up there. Tarik, if anyone wants to reach out and get in touch, what's the best way to do that?
The only best way is to just look me up on Twitter. It's Tarik_Sammour. And yeah, feel free to ask me any questions or reach out. Very happy to talk to particularly any Bitcoiners. And if there's any medical people out there that want to talk about it too, I'd love to do that.
Well, thank you so much for your time tonight.
Thanks, Jake. Good to see you again.